Hi ladies, it's Elizabeth Murphy. I would normally be standing in front of you as the MC for the women's gathering, benefiting spiritual care at Rogers Behavioral Health. But this year I'm at my house and you're at yours because the public health crisis in our nation has made it so that we're not able to be together, and I'm really going to miss that. I'm going to miss the warm embrace of friends old and new. I'm going to miss the energy as women, wonderful women, gather for a worthy cause. I'm going to miss the door prizes and the raffles and the excellent meal and the spring flowers and even the chance to tell you to quiet your happy chatter so that we can begin the program. And this year's program, the theme is self-awareness, recognizing and honoring your spiritual and mental health. I don't know that that's ever been more relevant than it is now. And I don't know about you, but being self-aware to me, it means making changes. It means in these challenging times, we have to adjust the way we care for ourselves. For me personally, I'm a reader. I read my Bible early in the morning, and I'm used to spending a lot of time doing that and digging deep, and I'm finding I can't concentrate like I've been able to in the past. And I've had to just take a verse or two, something I can remember and recall throughout the day when I'm in need of hope or encouragement. I usually sit still in prayer, but I'm finding air and prayer work better for me these days as I need to get outside and I need to move my body. So I'm finding prayer walking with my dog. It helps me to think differently and therefore to pray differently. Those are changes, maybe good, maybe not, maybe permanent, maybe temporary, who knows. My family hasn't dealt with illness or death, but we've dealt with loss. The loss of gatherings and occasions and memory-making opportunities, and I'm really sad about that. And I've had to give myself permission to be sad. We all need to do that. Spiritual care is critical for ourselves and also for the patients at Rogers. The children, teens, and adults who are receiving care at Rogers. Christine Dolly, the manager of spiritual care, tells me that they are requesting individual consultations more than ever before. In fact, they've had to set up a telehealth program, or they've been able to set up a telehealth program to care for those who need things at home so that they could continue, the chaplains could continue the good work that they do, and they could help answer the questions that are being asked, like how could God do this, or where is God in this? And I am really grateful that the Rogers Foundation has 100% funded spiritual care in the past. And the Women's Gathering contributes a significant portion to that funding. Because we can't gather this year, the opportunity to give as we have traditionally in the past has changed. And I'm asking you kindly to be creative. Consider continuing to give to Rogers Behavioral Health. At this time when the need is even greater, I hope and pray that the provision will be greater too. Be well, stay safe. We will look forward to seeing you next year for the Women's Gathering on May 18th.